permissions to do their timely CICs and make sure that their health is not compromised on these accounts. That's very important.
Yes, absolutely. Having wheelchair washrooms and ramps is very, very important all over. Moving forward, Dr. Shalini, we've talked about the treatments and how SCI patients are rehabilitated. What I'd like to know from you is that how does ISIC maintain the quality of treatments, all the treatments that are done in ISIC?
Thanks, Karishma, for this wonderful question. While most of it has been answered, let me just structure it very properly. So first of all, any value-based organization will always focus on quality. In fact, abroad, there are models of reimbursement based on value-based where you measure outcome. And of course, India has still some distance to travel with that. Having said that, since the question is pertinent and specifically about quality, you always break it down into the Donabedian model of structure, process, and outcome. So when we begin with structure, as has been already, informed by this wonderful group, is that first of all, it begins with access. So the access, the hospital has been made with very easy access for people who require special needs. And not only that, I think one of the other things is just the corridors and et cetera, are also much wider than normal hospitals because a lot of patients would be on stretchers, etc. So you need that much extra space while you're rotating, and as well as the OPDs, most of our OPDs are very large, and the entire structure has been made to be friendly with people who have special needs. The other thing is, of course, where our selection of our doctors come, as well as the multidisciplinary approach to this entire problem. And most of the experts are sitting here right in front of you as well. So there is an entire team, not just by supported by a surgeon, but there is neurourology, there is rehabilitation, there is support of orthotics, there is support of plastic, there is support of nursing, and also physiatry. And also extremely important is psychological support. And psychological support comes not just from having a psychologist, but also the support given by physical rehab as well, because that's going to again contribute to your physical wellness. So while these structures are in place, we also have the latest technology, which everybody has already summarized, and we have state-of-the-art OTs and technology, again manned by really, really good surgeons, as well as post-operative care. Then we come to the processes. So clinical processes, I think I'm not going to get into. We've already spoken about it in detail, and there are structured ways in which how the patient is evaluated. How will we operate? What is the modality that we'll operate? What is the modality of anesthesia that we will do? What are the various drugs? And the entire team gets into action about it, including everybody sitting over here basically contributes to the care of the patient. So those are the different processes. Now, when it comes to outcome, while I think that is something that even the entire world hasn't really caught up, because it is very difficult to measure apples to apple, considering, for example, just by race, it would vary, the outcomes would vary. And based on the experience and the data that also comes into different countries from different societies that make guidelines is another thing. So, for example, the neurosurgery society states not to do a vertebroplasty for an osteoporotic patient, whereas the American Society of Surgeons says otherwise. Therefore, it does sometimes become difficult. Therefore, what we do is we follow clinical-based, evidence-based guidelines for all our processes, and we measure our outcomes. There is an outcome for right starting from measuring patient falls to hospital-acquired pressure ulcers, etc. For functional assessment for physiatrists and as well as for the rehab. There is goal planning that is done collectively with the physiatrist to measure the outcome of the patient, supported fully by rehab team, as well as by the doctor who's totally involved in it, as well as having psychological support. Nonetheless, while we are still working on patient-related outcome measures, etc., that would vary from surgery to surgery, which would be very difficult to do. At the same time, I think that's one of the things that I, as a medical director, would like to move forward with the medical teams in how we can actually publish our outcomes very systematically based on some international guidelines, or even if we could develop our own guidelines considering the amount of data, population, and information that we already have based on that. So I think that's about it in a nutshell, how we monitor quality of our spinal cord injury patients in a hospital.
Thank you so much. Thank you so much, Dr. Shalini. Moving forward, we also have few questions. We'd like to quickly throw some light on our questions which have been shared by our participants. This question is for Dr. Neetu. Dr. Neetu, Shivanshu Sharma, one of the patients who's joined us, is wanting to know, after a spinal cord injury, I have complaints of constipation on and on. Could you please help him over here?
Yeah, so after SCI, usually bowel and bladder get involved. So in this, what happens, brain stops sending these signals or not able to communicate below the level of injury. So in this, usually what happens, SCI individuals, so they don't know when their bowel is full or when the bowel movement is about to occur. So this loss of sensation or function is called neurogenic bowel. So in this neurogenic bowel, we actually have to plan bowel training programs, individualized, specialized bowel training programs for our patients. So what we are following here in ISIC is we offer laxatives previous night to the patient, 30 to 45 ml, then insert suppository on the following morning, and then wait for 15 minutes, then provide commode chair to the patient, and patient may sit on the wheelchair, on the commode chair for 45 to 50 minutes for the better bowel movement. And then we can initiate the peristalsis movement by abdominal massage in rotatory movement or by pressure when person can bend forward. And if result is negative, then the manual evacuation of stool can be done. And note that here hot beverages like tea or coffee can help to stimulate the bowel, and regular exercises are very important again to prevent constipations. And scheduling of a bowel training program is very, very important again. Then the fluid intake is also important, like 2 to 2.5 liters of fluid if patient is on CIC, which helps in soften the stool. And then the diet. So high fiber diet is recommended, so fiber at bulk, and it helps in the bowel movement. So that is what we are following here. Thank you.
All right, thank you so much. Next, we'd like to ask Mr. Nekram a question. This is Ria Segal. She'd like to ask, how can one maintain posture while sitting on a wheelchair for a longer duration?
Yeah, it's a very important question. Thanks, Ria. So sitting on a wheelchair is not that easy. If somebody is, confined to a wheelchair and then working or maybe studying and or going out, the person has to remain onto the wheelchair all the time. So it's very important how to take care of the posture and positioning, not for only preventing the secondary complications like deformities, but also preventing the pressure source. So in most of the cases, what you can do, of course, you have to meet someone who is seating specialist. It's not that you select your own wheelchair or seating from anywhere in the open market, but then you need to go through a person who knows you and can suggest better seating and positioning mechanism into a wheelchair. Because wheelchair is a two-part. Most of the people think of a wheelchair as just for mobility, but that has very significant role for being seated also. So seating and mobility is two different things. People buy a wheelchair just for mobility, but they forget about the seating in positioning into the wheelchair. So I would recommend that if you have such issues, then first of all you need to meet a seating specialist, or if around you, and if not, then you, of course, if you can reach out to us, we'll be happy to help you out. Or if you want to take precaution by yourself, then of course at least you can put a cushion or a foam cushion or gel cushion under you, Your hip level and knee level should be the same. Your wheelchair width would be the, according to your seating width area, cannot be broad, cannot be too narrow. Your back positioning up to your level of control of your trunk, you cannot have that back so high or so low. It should be according to your trunk balance level. Your knee level, your foot positioning onto a wheelchair has to be very important. So your alignment, your posture into the wheelchair is very important. If you're leaning onto one side due to your muscle weakness, then the wheelchair seating should be made in a way so that can erect your posture and keep you upright in positioning. So we have a formula called 90-90-90 degree formula, where means like your hip and trunk level should be on 90 degree, your knee should be on 90 degree, and your foot ankle should be on 90 degree. So if you maintain this 90-90-90 posture, I'm sure you will have better positioning, you can sit for longer, yeah, and then you can prevent your skin breakdown also. So that is my suggestion. Thank you.
All right, thank you, Mr. Nekram. Dr. Das, we also have Vishnu. He is wanting to know about epidural stimulation and whether it can help him or no.
Whenever there is a spinal cord injury, the afferent and the efferent fibers both are affected, which means the sensation of motor and power coming down from the brain is obliterated at the site of the injury. So what happens, there can be phantom sensations, there can be sensations which may or may not exist because they are beyond the stage of the lesion. Secondly, there can be intractable pain because of the nerves. So spinal cord stimulation is a specific device which is introduced to address specific problems, like if there is a chronic pain, then a spinal cord stimulator helps you to take care of the pain. And if there are some sensory fibers or motor fibers that are still there, which might be lesser in voltage or in amplitude, the spinal cord stimulator can stimulate like a pacemaker to regenerate some of the existing power. But if you have a feeling or if you have a question that whether spinal cord injury can bypass the level of the lesion to get back or to bridge the non-existent spinal cord over the lesion, then it is not a question that can be answered at this moment, because most of the extra aspects of the treatment with spinal cord stimulation is still on an experimental basis.
Thank you so much, Dr. Das. The next question is by Soumya. Dr. Vikas, I'd like you to please answer that. Hi, my mom is having pain on the right side of spine in waist, and she is also unable to move easily. Could you please guide us how to reduce the pain for that?
Soumya, you have not given. Okay. So Soumya has not given the complete history. The patient is a SCI patient because this needs to be examined clinically then.
All right. I
Yeah,
understand.
so this would be a little difficult to answer like this.
Soumya, we'll get back to you.
Yeah.
In case you can share some
So
reports.
Soumya will get back to you.
Moving forward-
Leave your email ID. Probably we'll get back to you on that. Right?
Moving forward, we also have Mr. Nikul. Hello, sir. My name is Nikul Nikul, complete D3, D4 injury level. What is the best treatment for spasticity? And I have too much spasticity problem. How can I deal with that?
Okay. So yeah, spasticity. If you have an injury in the neck region or in the thoracic region wherein you have a complete injury, spasticity is a part and parcel of the injury. We grade spasticity based on a grading system. We call it as a modified Ashworth scoring system. And the treatment is based on the amount of spasticity that you have. So usually there are drugs which are there which can take care of the spasticity, like baclofen. It's a drug which can take care of that. But sometimes, so we use this drug in the range of 10 to 90 milligrams of baclofen can be used in a day, in three divided doses. Okay. Sometimes these things don't work, and then there is something which is called as a baclofen pump. There are certain guidelines. So most of the times, I would say 90% of the times, you would be able to manage the spasticity that comes with spinal cord injury with the help of oral medications like baclofen. Similarly, when the spasticity is too much, which cannot be taken care of by the oral medication, you need to instill or put this drug intrathecally. That is, you put it inside the spinal cord. So this is done with the help of a baclofen pump, which is an expensive device, though, yes. So what we do is, there's a protocol for doing that. We do a baclofen pump trial. We take the patient up in the operation theater, and we put in this drug intrathecally, and we see and we observe, based on the Ashworth grading, how much change is brought about pre-operative and post-operative, or let's say post instilling the baclofen pump, and we see the difference in the grading on the Ashworth grade. If it seems that the patient has improved by 2 grades of Ashworth, it's advisable to go ahead with the baclofen pump installation. So then, and then second stage, this baclofen pump is instilled. It's put in the stomach of the patient, actually quite superficially, not deep, and that's a good way of dealing with spasticity. The only problem with baclofen pump, only problem is it needs to be refilled again and again, and and this drug is a little difficult to get, but yes, it is a possibility.
Okay, thank you so much. Dr. Dinesh, the next question is for you. This is from Mr. Rao. I'm using urine bag. Whenever urine is blocked in the catheter, my 2 legs shake. I can't control shaking my legs. Could you please explain me why this has happened to me?
Exactly. This is in continuation to what Dr. Vikas elaborated. The spasticity, apart from being a neuropathophysiological phenomena of a suprasacral injury, it is also important to appreciate the exacerbating, aggravating factors which lead to heightened spasticity, relief of which will lower the need of the dosage and the drugs required to control the spasticity. Appropriate bladder management, control of the intravesical, that is inside the bladder pressures, avoidance of infections, and ruling out any pathology inside the bladder such as a stone, a tumor, or active inflammation, impacted feces or stool in the bowel, presence of infected pressure sores, or in fact even painful toenails or some form of infection in the lower limbs, DVT. These kind of things can also be the reasons why the body responds with increased spasticity. Now coming back to the question as forwarded, the intravesical pressure, as it increases following the blockade of the catheter, it sends the stimuli going towards the brain. However, because of the spinal cord injury, it cannot go above. So therefore, it spills in the region below that and manifests itself as the increased spasticity in the involved skeletal muscles. So this is a reflection that the person who is using a particular form of bladder management, he needs to either learn to modify or do it better, or preferably change over to an intermittent catheterization and get back to his urologist for doing a urodynamics, use of bladder medication to control the bladder pressures inside. There are very good medication which is available today, very good advanced forms of therapy like botulinum toxin, sacral neuromodulation, and variety of other options available. If the pressures remain low in the bladder and patient is free from infection, the bladder causes will be ruled out as a cause worsening the spasticity. One will feel much better.
All right, thank you so much, Dr. Dinesh. We have Himang Arora asking, what should we do if we have dizziness or heavy head while changing the position, which means turning, shifting? Dr. Chitra, would you like to answer that question, please?
So dizziness may be because of postural hypotension also. So while if he is sitting on a wheelchair, if he feels giddy, then just ask the caregiver, or if he do himself, just tilt the wheelchair. And
okay, Dr. Neetu, would you like to add on that?
Yeah, means OH is basically when you change the position, the fall down in the BP within the 3 minutes of changing the position is called OH, or the orthostatic hypotension. So person if is complaining of this, then they should continuously monitoring their BP within the time interval of 3 minutes, twice in a day at least, so they can maintain the chart and they can seek the medical help in this case. And gradual sitting is actually recommended. Like person should start sitting in like 30-degree, then 40-degree and so on. So gradual sitting helps actually. So body gets time to adjust with the BP, right? So that's the thing. And secondly, if still the symptoms persist, then we advise salt capsules to the patient. And if still the symptoms persist, then medical help should be sought. So that's it.
Okay, all right, thank you. We'll take one more question before we close the session. This is regarding a wheelchair. Someone needs suggestion. This is Abhinav Saxena. हेलो, मेरा क्वेश्चन नेकराम सर से है. क्या आप मेरे लिए कोई व्हीलचेयर सजेस्ट कर सकते हैं जिसमें मैं बैठ सकूं कंफर्टेबली, क्योंकि मुझे 9 से 10 घंटे व्हीलचेयर पे बैठना होता है, जिसकी वजह से मुझे काफ़ी पेन होता है. आप प्लीज़ मुझे सजेस्ट करेंगे.
थैंक यू, धन्यवाद अभिनव. मुझे याद है आप हमारे यहाँ 4-5 साल पहले आए थे और हमने एक व्हीलचेयर आपके लिए बनाई थी. और ये मोस्ट कॉमन क्वेश्चन है ज़्यादातर व्हीलचेयर यूजर्स का, सिटिंग एंड पोस्चर को लेके. आपका अकेला नहीं है, बट ऑफ कोर्स मुझे याद पड़ता है कि आपके लिए हमने जो मोटराइज व्हीलचेयर बनाई थी बहुत स्पेशल कस्टमाइज़ किया था, क्योंकि आपका पोस्चर थोड़ा डिफॉर्म्ड है, आपकी स्पाइन, और करेक्टिव सर्जरी हो नहीं सकती. तो इस वजह से हमने व्हीलचेयर में ही आपकी एक पोजीशनिंग करी थी. तो उसके लिए एक्चुअली यहीं आना पड़ेगा, और आपके साइज़ के लिए एक व्हीलचेयर हमें प्रॉपर साइज़ की व्हीलचेयर कस्टमाइज़ करनी पड़ेगी. व्हीलचेयर से ज़्यादा हमें आपकी सीटिंग, जिस पे आप बैठते हैं, जो उसकी सीट है और बैक है और आर्म रेस्ट है, फुट रेस्ट है, आपका लेग रेस्ट है, उसको बहुत अच्छी तरह से आपके कंफर्ट के हिसाब से टेस्ट करना पड़ेगा. और इसमें हो सकता है आपको 1 या 2 दिन के लिए आना पड़ेगा, क्योंकि आपको कुछ देर के लिए बिठाना है, चलाना है. जब आप कंफर्ट फील करेंगे और एक क्लिनिकली रिकमेंडेड पोस्चर, हमको जब तक हम सेटिस्फाई नहीं होंगे और आपका कंफर्ट जोन नहीं होगा, तब तक वो मैच नहीं होगा. तो इसीलिए, क्योंकि आप बाहर से आएंगे, तो 1 या 2 दिन का टाइम लेके आएँ, और प्रॉपर हम यहाँ पे सजेस्ट करेंगे कि क्या पोजीशनिंग है. उसके बाद देन वी विल मेक अ रिकमेंडेशन कि आपको कौन सा व्हीलचेयर लेना है. हम आपको प्रिस्क्रिप्शन देंगे और उस हिसाब से आपका व्हीलचेयर बनेगा. और अगर चाहते हैं कि हम बनाएंगे, तो ऑफ कोर्स यू कैन रीच आउट टू अस.
Okay, thank you so much, Mr. Nekram. We do have a little more questions, but we are running out of time. But we will get back to all the questions in case we miss out any. We'll quickly wrap up. Before we close, can I please request Dr. Vikas to share some highlights of the session, and in case he'd like to add something on the World Spinal Cord Injury Day, 5th September.
Thank you, thank you, Karishma. I think the panel went very well. The talk went very well. But I'm sure we have not answered all the questions. So please get back to Karishma with all your questions. Just add your email to it, and we will get back to you on that for sure. Number one. Number two, Spinal Cord Injury Day. Yes, we are celebrating again this year, and we are celebrating in a big way. Yesterday we had a huge event, wherein in the morning we had a cyclothon. We had a lot of people, more than 100 cyclists joining us for the cause. The cause, yes, the same cause. We are advocating for an inclusive society for our spinal cord injured patients. After that cyclothon, we had a wheelchair rally, wherein we had more than 100 wheelchair users and more than, I think, 500 other people who were there in the rally, and again for the same cause. Today we are having this live chat session with you all. We tried our level best to answer your queries regarding the spinal cord injury and subsequent management. Tomorrow again we have a more inclusive cultural program, wherein we have presentation and dances from the wheelchair users, along with the and we also have sports activities, wheelchair activities tomorrow. So yes, we are trying to do our level best in advocating a more inclusive society, because we don't take you apart from us, from us. You are a part of us basically, and we want to make a society where you feel that you are a part of it just like we are there. And we want to create equal opportunities for all of you in this society so that we all live together in harmony and with all the, the best of the best, actually. Thank you.
All right, thank you so much. Thank you so much, Dr. Vikas. Thank you to each and one of you for joining us in today's session. Thank you to our audience, everyone who asked questions. We will make sure we get back to all of you in case we've left anything. We close the session with this, and thank you once again. Also, to everyone, please do stay connected to our Instagram pages, to our Facebook pages. We are posting all of about our 3 days event going on and spreading awareness on SCI Day and advocating for for an inclusive society. So please do stay tuned on all our social media platforms. This is Indian Spinal Injuries. Thank you so much, everyone, for joining us.
Thank you so
Thank
much.
you so much. Thank you.